Hello, everyone. Now let us to start our lecture for today. This is the third lecture in health law in Sudan. Last lecture we discussed about legislation, and we say this is approved by constitution. Additionally, when pass this legislation to the parliament will be approved. Approved by parliament will be the law. Yeah, and additionally, there is the details of the article to explain the people how can apply that law through the articles and details how can apply that. Yeah. For this lecture today, we are going to see what is the importance of the law in yeah, what is the importance of the law in health, yeah. The importance of the law in the health and what is the benefit of the application of the law. To give this law or the power okay, yeah, to the importance of this law is very important to give the power this law, and we are going to go to see the health first also to give the short definition of the health.
Let's please your voice. Hello. Have your
Is it
voice, please.
now my voice is it audible or is it audible now? Hello?
There are voice invitation, but I don't know where. Ibrahim, you have to close your microphone.
Yeah, yeah, all of you, you have to close your microphone, yeah, to avoid the reflection of the voice, yeah. Now is it clear? Hello? My voice now is it clear?
Yes, it's somehow clear, but it's still there's some kind of interruption. I don't know whether it's network or what it is exactly.
Okay.
Hello, teacher. Hello,
Yes.
teacher. Hello.
Yes.
Hello, teacher.
Hello, hello, yeah, I'm hearing you. Go ahead. You need to say something.
Your sounds are not clear of your voice.
Yeah, now it's clear or
Your
not clear?
sounds are not clear of your voice. Also now it's clear.
Now is it clear?
Yes,
Hello?
it's clear. Continuous.
Okay, okay, nice, yeah. To go this lecture, we are going to see the
Yeah,
importance of the law and how we can protect it. Yeah. Additionally, let us to give the short definition of the health. The health is more than medicine; it is a framework of rules and system. And in this lecture, we are going to explore how legislation and regulation protect the population, additionally to ensure the safe treatment and also guarantee the equitable access to the care and forming the foundation of robust of the health system. As I mentioned, this in this lecture we are going to see the importance of the health law. What is the importance of this law? The health law transit more regulation and the foundation instrument for saving the life and ensure the well-being. Why it is this dispensable? One of the important of the public health law is to protect the life. The health the WHO in 1948 is ensuring the health is essential for the all people and especially vulnerable population. Yeah. Yeah, this is a law assigned by World Health Organization, and he mentioned the law or the health is the right of the human being. This is the one of the important of the law to protect the right of the human being. This is the one of the important. The second important of the public health law to control the disease. As you know, during the outbreak or pandemic, there is the explosion of the many disease here. By this law can help us how we can control this disease. There is someone his mic is unmuted. Yes. Yeah, Nuruddin, yeah, is good now. Yes, as I mentioned, the second important of the public health law is the control disease here. Last time or even now, there is a many outbreak like cholera, COVID-19, and this disease is very rapid for the, dissemination or to spread among the community. By the law can stop the moving of the people, lockdowns, and also apply the precaution for the transportation. All this can control this disease to spread early or to spread rapidly among the community. This is the second objective of the law. The control disease enable the rebel and decisive action during the outbreak, like borders closure, and additionally mandate to use the mask during the COVID-19. This is the second important of the health law. The third important of the public health law is to ensure the safety, regulate the medicine quality, and also hospital safety standard and professional license by the public health law can help us to ensure the safety of the medicine of the quality like drugs. If you need to import the drug from the out country, is very by the there is a health law to do the cross check with that drug. Is it good or with our beneficiaries or with our community or not? Yeah, this is the one of the safety insurance. Additionally, for those whom study in the public health, even study the medicine, they must have the license. This license can save the life of the beneficiaries or the population, or additionally can save the life of the community because before they are going to do the correct check with this cadre or with this person, is it have the good qualification to give that license. Yeah, this is the second benefit of the why is the public health. No, this is the third. The fourth important of the public health law is the guidance workers. Define the professional boundaries and responsible such as the prescription authorities and infectious prevention and control by the law can help us to apply the IPC infection prevention control at the hospital level and all or yeah, at the hospital level or clinic level, this IPC regulation can help us to control of the spread of the disease. Yeah, by the public health law can let us to guide our workers or health workers. Yeah. The last important of the public health law, it is a support program provides the legal and financial backbone for critical public health initiatives like vaccination campaign and also malaria prevention and maternal and child care to ensuring the sustainability and effectiveness by the public health law can help us to support the programs like a vaccination initiative or vaccination campaign or mother and child care to ensuring the sustainability, to ensuring this service is a continuous with the child and with the mothers to make sure they're good in their health. Yeah. This is the five very important point why the public health law is important. One of them, I mentioned it, is protect the right. As I mentioned, the WHO in 1948 is the founder, and he mentioned the health for the all people, or the health is the right for the all people, especially vulnerable group. The second benefit of the public health law, the control disease. By the public health law can help us to control the outbreak or the pandemic disease with apply the regulation like lockdown and also closure, border closure, and additionally to organize the movement of the people. The third importance of the public health law ensures the safety of the workers, their good safety in their working place. Yeah. This is one of the very important of the health law. Additionally, also he mentioned the guide the workers to define the profession boundaries and responsibility to know what their his responsibility are. Moreover, we have the support of the program. Yeah. This is the important of why the health law it is are crucial or is important. Yeah. If find some question like this, one of them you can mention the protection right, control disease, ensure the safety, and guidance the workers and support the programs. Yeah. Now let us to go to next slide to see the global success story in the health regulation. Now let us to say to see the first uh, country, or let me to say yeah, first example like Rwanda. The after genocide which take place in Rwanda 1994, the Rwanda put it the health systems and rebuilt and with strong legal foundation. The mandate for free maternal and child care and community health workers every village have led to significant improvement in the child health outcomes, making the one of the best health system in the Africa. This is the one example, Rwanda. Second example, in USA, there is a regulation like FDA, Food and Drug Administration, which enforce the strict law for the drugs and vaccine approval. Any any drugs, if you need to work in the USA, you should have to get the approval from the Food and Drugs Administration. Even the vaccine, even the anything, you have to get the approval from the FDA. By this way, they let the USA one of the best system, a health system here. Last example, India, national health policy. The India commitment to health for all by 2030 is a confidence in the law that guides the resource allocation for the hospital and clinic and preventive program. This legal framework has expanded to access affordable care and demonstrate how the policy drive equitable health services. By national health policy in India, Now they are putting the plan in 2030 to let the access all health service and affordable for the whole community. Also, this is a good example. This is a successful history around the world why the health regulation or why the public health law is important. One example which I mentioned, the Rwanda. After the genocide, they are decided or they put it the health law and they are mentioned. The mandate the free maternal and child care. By this law, let the Rwanda become one of the best health system in Africa. This is the one example. Second example, USA FDA standard. Let us or let the USA to become one of the best standard of the law in the world. Last example is the India National Health Policy. They are put it plan to commit it to health for all, to provide the service to all people around India. This is a successful story of the in health regulation. Now let us to go to next slide. Uh, Let us to see the framework, Sudan Health Framework. Number one, in the constitution of the Sudan in 2005, there is like 38 article, the right of the health. In the article 38, they are mentioned, right to health care and medical treatment is a fundamental constitution right, forming, forming, yeah, in the Sudan, the 2005 constitution, they are mentioned, the health care, it is a fundamental right for the all population or all people in Sudan. Additionally, public health law empowering government to control infectious disease to ensure food and water safety and close permission posing the public health risk such as unsanitary market and slaughterhouse. This is the Public Health Act. Also, we give the government power to ensure clean water and also to good sanitary, even the good sanitary at the market level and also at the slaughtery. The third pharmaceutical law, also in Sudan, take place. The regulate the import of the medicine. If some organization or some agents need to bring the medicine from the out of Sudan, also he have to follow the regulation of pharmaceutical regulation to make the check and to find these drugs it is not harm to the population. There is the money list or checklist, yeah, they are doing, yeah. Also, the Medical Professional Act define the license and monitor the medical practitioners. Yeah, also in Sudan here, there is a Medical Professional Act. By this law, can make sure that medical doctor and also public health professional have the licenses. When you have the licenses, that can approve it you to practice your work here. There is a permanent license required for the all practitioner in the medical field. Yeah, this is a health regulation legal framework. As I mentioned, one of them, the Constitution of 2005, which they mentioned the healthcare law is the right for the all Sudanese people. Additionally, public health law is empowering the government to do the control of infectious disease, especially during the outbreak or pandemic. Last, thirdly, the pharmaceutical law also they regulate the import of the medicine. The fourth, the medical professional law, they require for the any graduate from the medicine or the public health to do the license, this lesson to approve them to practice the work. Yeah. This is the Sudan Health Regulation Framework. Now let us to see the impact of the key. Yeah. Now let us to see the impact of the key health law and policies in Sudan. The examine specific health policies reveal their various impact ongoing challenges. One of the policies or impact of the health law and policy in Sudan is the national malaria policy. In national malaria policy, they are enforcing implementation the various significant across the whole state in Sudan. They are guiding the policy, support the free testing and treatment, and additionally distribute distribute the mosquito net, and moreover they are doing the indoor spray. Yeah, this is the binational malaria policy. Yeah. In many states, on all states, they are required this one to provide the treatment of the malaria and additionally distribute the mosquito net and moreover indoor spray. This is the national malaria policy. Secondly, the tobacco control law, which she approved 2013. This law, the ban smoking in public, smoking in public, tobacco advertising and sale minor impact reduce the public smoking. Yeah. By this law or tobacco control law, it is prohibit to smoke the tobacco among the public place, and additionally to ban smoking in public. This one, tobacco advertising and sale in the minor area. This is the second impact of health law and policy in Sudan. The third one is the Reproductive Health Act. The proposed law to guarantee this is the third impact. This is the third impact health law and policy in Sudan. The Reproductive Health Act. The proposed law to guarantee prenatal and antenatal and postnatal care for the whole child. This is required by Reproductive Health Act. The lastly, the Mental Health Act. Also currently now repose the mental health law exists, leading to inadequate care and rise the violation, and now draft seek to protect the patient right and establish the clinic and train pediatric psychiatric address the critical public health gap. All this the impact of the health law and policy in Sudan. Now let us to go to next slide and see the challenges and path forward in Sudan to apply the health law. One of the challenges, the weak enforcement, and additionally outdated legislation, and also conflict and instability. Moreover, lack of awareness and poor coordination. All this is considered as the challenges to apply the public health law. Weak enforcement. Many laws remain unenforced and leading to persistent issues like public smoking in restricted areas and circulation of the fake medicine. This is the weak enforcement. Additionally, outdated legislation. Existing law often stem from the colonial area rules, lacking the provision of modern health challenges. Yeah. The third one of the challenges of the public health law, the conflict and instability. The ongoing conflict since 2023 has devastated healthcare infrastructure and displaced workers and shattered the supply chain and rendered effective legal enforcement. The fourth one, lack of awareness. Both citizen and healthcare provision often lack of knowledge of the health right and legal obligation. The last challenges of the past public health law is the poor coordination here. Discrepancies and lack of the coordination between the Federal Ministry of Health and State Ministry health authorities here lead to confusion and inefficiency critical like vaccination and campaign. Yeah. This is the challenges of the to apply the public health law. It was last lectures. Now follow for you. If the some question or explanation, the follow for you, and you are welcome. Yeah. If there any comment, if any question, the floor for you, and you are